Hi there, this is Dr. Linicky again doing a short podcast here on aquatic exercises. So, the definition of aquatic exercise is the use of water that facilitates application of established therapeutic interventions. You can use the water to adjunct many of the things that you plan to do on the land. It can help with motion, with strength, with stability. The diagnostic prescription of exercise doesn't have to be drastically different in the water than it would be on the land. You just have to understand the principles of aquatic therapy to be able to prescribe the correct exercises. There are several goals and indications for aquatic therapy. So, if you want to facilitate range of motion, weight bearing, and cardiovascular exercises in individuals who may have difficulty with that in the land, aquatic exercise is a good option. You can initiate resistance training and functional activity replication with enough creativity. It does help to enhance the delivery of manual therapy techniques, and it can be good for patient relaxation. It can provide a three-dimensional patient access, so you can work with the entire patient and still be able to functionally assist them. And it does minimize the risk of injury and re-injury, especially in those who their greatest risk of injury has to do with full weight bearing. Right, who do you need to be careful with getting into the pool? First are those who have a fear of water. If a patient is very scared of water and you're suggesting aquatic therapy, not all of them can get over that fear. And so you need to make sure that patients will be comfortable in an aquatic setting before you try to put them into the pool. You may need to go into the pool with them to assist them if they do have a great fear of water, or they may not even be able to go in. Certain neurological disorders, especially individuals who have ataxia, which is an abnormal gait pattern, they're going to have an increased difficulty in controlling their movement with ataxia. Respiratory disorders, if you have difficulty getting a full breath, you may have even more difficulty in the water due to limited lung expansion. The pressure of the water is going to be pushing in on the lung. If a patient has cardiac dysfunction, you need to monitor them carefully. You also need to be careful of the temperature of the water. These are individuals that if the pool is very warm, they may overheat and have more cardiac problems. And wounds. If you have a small wound or a small line that can be covered with an occlusive dressing, something that's not going to allow water or any of the pool material to get into the wound, and also going to prevent any of the wound material from leaking into the pool, you can still get into the pool, but you must cover it up. All right, what is contraindicated for getting into the pool? Somebody with unstable angina, so they're having chest pain that is not well controlled, they shouldn't get in it. If your vital capacity is less than 1 liter, or you have severe peripheral vascular disease, you're not appropriate for the pool. Any danger of bleeding, severe kidney disease, open wounds that cannot be covered, you should stay out of the pool. Anybody with uncontrolled bowel or bladder is going to contaminate the pool if they get in. And the same thing with menstruation. Unless they have some kind of internal protection, they need to stay out of the pool. Anyone who has water or airborne infections is also at risk of spreading the disease to others. And someone with uncontrolled seizures should not be getting into the pool. All right, we're going to talk about several properties of water, and during the lab we did go over some of these, but I'm going to explain them in better detail. So the first is buoyancy. Buoyancy is the upward force that works against gravity. When a patient is in the water and it is neck deep, approximately at C7, only 10% of the body weight is on their feet. The rest is carried by the buoyancy of the water. At the xiphoid process, there's approximately 33% of your body weight on your feet, and at your ASIS, there's about 50%. So buoyancy can provide relative weightlessness and joint unloading, reducing the force of gravity. It can provide resistance to movement when a movement is forced against gravity. Against the force of buoyancy. So that would be when we took those styrofoam dumbbells and tried to push them into the water. The resistance is the movement against that force of buoyancy. Body composition will also affect buoyancy. So obese patients have increased buoyancy, so they will float a lot easier. Patients who are solid muscle or have very dense body structure have less buoyancy. The next is hydrostatic pressure, and this is the pressure exerted by the water on the immersed objects. The deeper you go, the more pressure that you will note on an individual. And so if someone is standing, they're going to have more pressure on their feet from the hydrostatic pressure, so more pushing in than they will in more shallow surfaces. This does increase peripheral blood flow, causes some venous return, but it can induce bradycardia, so a slower heart rate. The next property is viscosity. So this is the friction that occurs between the molecules. And so the faster you try to move, the more resistance you're going to have to that movement. Okay, so the viscosity will be higher. The slower you move, the less resistance you will have. So we noted this in some of the exercises when I had you float your arms to the top, and then I had you move your arms quickly. It takes a lot more force to move it quickly than it does to move it slowly. Now we're also going to talk about thermodynamics and the center of buoyancy. So thermodynamics is the effect of water temperature on the body. So every substance has something called a specific heat. For any of you who had chemistry, you probably learned this in the past. So the specific heat is the amount of heat required to raise the temperature of something, of one grab of a substance by 1 degree. So the specific heat of water is 1. The rate of temperature change will be dependent on the mass and the specific heat of the object. So the object we're concerned about typically is the patient that's in the pool. The water will retain heat thousands of times easier than the air, so you will have less change of temperature in the water. But that water will conduct the temperature change faster. So in other words, an individual, when they're immersed in the water, will have a change in temperature faster than they would if they were in the air. This is something to be concerned about, whether the pool is colder than the patient or warmer. Okay. The center of buoyancy for most people is here in the anterior chest, but this will depend on the body type and the amount of adipose tissue and muscle they have. So some things to consider with temperature regulation. If you are doing an aerobic type activity and the pool is relatively warm, the patient is at risk of overheating. Patients who have arthritis prefer a warmer aquatic setting, but you do have to limit the aerobic type activity and how hard you are working them. They recommend that the patients who are doing mobility and functional exercises are in a pool between 26 and 35 degrees Celsius. So this equals about 78 to 95 degrees. Those who are doing aerobic exercises should have the pool below 78 degrees. There are many different types of pools that you'll see out there. The one here on the left is a larger pool. It looks like it has stairs leading into it and may even have parallel bars inside of it. There are also individual pools like the one here on the right that a patient can walk into and then they get filled up. There are also pools like our SwimX and many other varieties out there. All right, so Pseudomonas aeruginosa, I'm not even sure how to pronounce that, is something that you really need to be careful to avoid through regular cleaning and proper chemicals. Cleaning should occur at least twice weekly. Walking surfaces should be kept clean, slip resistant, and free of barriers. And make sure that safety rules and regulations are posted and enforced. Life preservers should be available, and staff members should be CPR certified at all times and present at all times. Safety is very important in the pool, and if you know you're going into the pool with a patient who is at risk, make sure that you have access to a call bell or have a rehab tech or another coworker near you at all times.